Hi, my name is Dr. Rudra Mohan, and through the Oral Health channel today we're going to be debunking the question whom to go for oral health problems, derm, ENT or a dentist. Let's start. So as a patient, I can understand your concern and empathize with your discomfort that you want the resolution to your problem as soon as possible. However, I've been getting a lot of calls and messages asking whom to show to ENT, to derm or to a dentist regarding their oral health problems. Now, I'm going to once and for all make this video and make you understand that what is the extent for a dermatologist when it comes to oral health problems, an ENT specialist to oral health problems, and a dentist's perspective when it comes to oral health problems. Any sort of skin related problems that are connected with the oral health problems of the mouth can be referred to a dermatologist, because there is a natural overlap. Because a lot of patients think that the oral mucosa or the skin of the mouth is very similar to that of the normal rest of the body. It's not, because this is keratinized skin. This is non-keratinized skin. You have to understand that it's moist, so its characteristics are very different. Needless to say, if you've gone to a derm, I would strongly recommend that even if you've gone to a dermatologist, better to get an opinion from a dentist as well about whatever's happening in your mouth. Secondly, when it comes to stuff like tonsillitis, any sort of diseases such as that require sinusitis, any sort of nasal related polyps, any sort of tonsillitis, any sort of retromolar areas which are in the throat, back of the throat, any sort of throaty things. Now that is actually the basically the expertise of the ENT specialist. An ENT specialist or an otorhinolaryngologist is basically an ear, nose and throat specialist. A lot of people think that the throat, the T is the tongue. No, the throat is the T in the ENT, and anything that falls backward from your uvula onwards is actually the expertise of the ENT specialist. I'm not saying that they cannot opine about whatever is happening in your mouth, because all of us have different postings when we are in dental school and whatever medical school, that there is an overlap, and that's why we need to obviously learn whatever that part of the overlap is all about. But needless to say, anything that falls in front of your uvula, the palate, the tongue, the gums, the teeth, the buccal mucosa, the cheek mucosa, the lips, all these things are actually related more to a dentist, and more specifically any sort of burning sensation is more related to someone known as an oral medicine specialist. You have to understand that when it comes to oral submucous fibrosis, along with oral medicine specialist, you have the oral and maxillofacial surgeon who take care of these things surgically. That's why they also come into the picture of these things. So I hope this gets clarified out, that it's very simple, that there is a definite overlap, but anything that is falling under the domain of anything in front of the uvula right up to the lips is that of the dentist thing. However, when it comes to the lips outer surface, right, the one that is very keratinized, you can go to the dermatologist for that also, because of again the overlap. So this was today's episode. Please like, share, subscribe and do press the bell icon button for important updates. If you want to get in touch with me, here are my social media handles and my WhatsApp number. Kindly refrain from calling directly, as I might be busy with patients. Just drop me a message with your name, your location and your common oral health problem that's causing you trouble, and I will get back to you within a couple of days. If you have any queries, suggestions, apprehensions or insights, please feel free to put them in the YouTube comment section. So that's it for today. Thank you.